Welcome to Advocate Broman Medical Center, and thank you for choosing our pediatrics unit for your child's care. As the only dedicated pediatrics unit in the area, we are privileged to provide care to you and your child. At Advocate Broman Medical Center, keeping our patients informed is a very important part of what we do. This presentation will give you a general overview of our services, facilities, and commitment to excellence, and what you may expect during your time with us. Please feel free to back up or replay this presentation at your convenience. You may do this by pressing the appropriate button on the handheld remote provided. Our nurses, nurse technicians, secretaries, and volunteers all want to make your child's visit as pleasant as possible. We are committed to partnering with you and your physician to meet your child's needs. Our nursing staff includes experienced registered nurses, many with specialty certifications in pediatrics. The efforts of our caring nursing staff are coordinated by the charge nurses. The charge nurse is responsible for daily operations and will talk with you about your child's care daily during your stay. Please feel free to speak with a charge nurse at any time. You will find the entire staff to be knowledgeable, friendly, and helpful. When your child is admitted, we will weigh him or her and ask you for other information, such as allergies. Any medications that your doctor has prescribed will be sent to the pharmacy and filled after your child is admitted to ensure safety. Normally, your child will be able to have a private room. Please make yourselves comfortable. The second bed is available for the parent to use. Your room has a call light to contact the nurse's station. The call light button and television controls are on the handheld controller. The bed controls are on the upper side rails of the bed. Your room is centrally heated and air-conditioned. If the room temperature is not comfortable, please use the call light to let us know that you need the temperature changed. We have a phone in each room for your convenience. Local calls may be placed at any time by dialing 9 to get an outside line. Local calls can be received from 6 a.m. to 10 p.m. Your family and friends can call your room by dialing 309-268-6 plus your room number. Your room has a restroom for private use. There's also a restroom located near the nurse's station for the use of any visitors. The tub and shower room is located by the nurse's station. Your nurses will help your child with his or her bathing every day. Please help us keep track of your child's liquid intake and output during your stay. We need to record how much fluids he or she drinks and bathroom use. You can help by keeping track of this on the white dry erase board located on the wall near your door. Your child's healthcare team will show you how to do this. It is also important that your hands and the hands of any visitors be clean to minimize the risk of infection and other concerns. Please feel free to use soap and water in the restroom. You may also use the hand sanitizer from the dispenser on the wall in your room upon entering and leaving your room. Allow it to dry thoroughly after rubbing your hands together. We offer room service dining for you and your child. Your child's physician decides what kind of diet he or she may have, and food can then be ordered between 6:30 a.m. and 6:30 p.m. You can dial 49-3000 from your room phone during this time to order meals. Please keep in mind that it takes approximately 45 minutes to receive your food. Please refer to your menu for further ordering instructions and food choices. A complimentary parent meal is provided for breakfast, lunch, and dinner. Extra guest trays may also be purchased from room service and paid for when delivered. The cafeteria and atrium cafe are also available for guest dining. A variety of drinks and snacks are available on our unit. Please ask your child's healthcare team if you need anything. We will take your child's temperature and other vital signs approximately every 4 hours, or more often if his or her temperature is elevated or the condition makes it necessary. We want to disturb your child as little as possible and will do our best to plan these checks when your child is awake whenever possible. We want your child to be comfortable. If your child is having pain, please call your nurse. Your child may have monitors or other equipment, such as an IV. If an alarm sounds on this equipment, please do not push any buttons or try to silence it. Call your nurse for assistance. Often, your physician will order lab work. This is usually done between 5 and 6 a.m. so that your physician will have the results during early morning rounds. We do, however, understand that this time is inconvenient for you and your child, and will try our best not to disturb you more than necessary. To make your child more comfortable during his or her stay, we do offer videos, toys, books, games, and video games. Please see the white binder in your room for a list of videos. Call your nurse at any time if your child would like to use our toys. We also have a visitor's lounge with a television and toys. Your child and guests are welcome to use this if your child's condition allows. Please check with your child's nurse before leaving your room. Your child's safety is very important to us. All children and guardians will have matching wristbands. These wristbands ensure that your child is never discharged from our unit with an unapproved adult. A security transmitter will also be placed on your child's ankle if he or she is 8 years old or younger. The security transmitters will prevent your child from leaving the unit through either door or elevator. If either the wristband or transmitter are accidentally removed, please tell your nurse. We ask that any visitors check in at the nurse's station before entering your child's room. After 8:30 p.m., visitors can only enter the hospital through the emergency room door. After this time, all visitors will be required to check in at the emergency room desk. Your child may need to be on isolation according to hospital policy, which is supported by the Centers for Disease Control. Special guidelines will need to be followed depending on your child's illness. Your nurse will talk to you about these guidelines. If your child is on isolation, he or she must remain in the room. Visitors should be limited during this time. If drinks or snacks are needed from the kitchenette, your nurse will be happy to bring them to you while your child is on isolation. We'd like to hear your comments on your experience. We've placed a feedback card in your room for you to fill out. You may complete this card and place it in the locked box at the nurse's station. If you are unable to find a comment card, please ask our staff for one before your child is discharged. These cards are used by our leadership team to provide staff with feedback and find out how we can improve our service. At the end of this presentation, you will see the pictures and contact information for the Pediatrics Unit's Director and Manager. If you want to talk, either in person or on the telephone, please don't hesitate to contact us. You may also call our Patient Relations Department by dialing 309-268-5053. Our Director, Manager, and Service Excellence Department are available from 8 a.m. through 4:30 p.m. Monday through Friday. To provide our patients the highest levels of quality possible, we also routinely do surveys after you return home. You may receive a survey in the mail, and we would appreciate your time in completing and mailing it back in the pre-addressed stamped envelope. We are committed to delivering high-quality health care and truly appreciate your thoughts and feelings. We at Advocate Broman Medical Center want to create the best place for patients to heal. We thank you for allowing us to provide you with care. At Advocate Broman Medical Center, you are important. We are committed to partnering with you and your physician to meet your healthcare needs. To learn more about Advocate Broman Medical Center, please see our mission, values, and philosophy statements at the end of this presentation. We have also included staff contact information should you need additional help or wish to provide comments on your visit with us.